Welcome everybody. We're just letting people in as they're joining. We are so grateful you all are joining us. We have more people coming in. This is going to be a great group today. I can already tell. This is fantastic. And as people are joining, I'm just going to take a minute and set the stage for everybody. So welcome, welcome, welcome. Thank you so much for joining us. I am Megan Diaz. I'm the program director for the Empowered Endings Foundation. And I'm so happy you all have decided to join us today for this session on the therapeutic use of psychedelics in end-of-life, palliative, and hospice care. We are joined by the amazing Sherri and Elisabeth Mack. They are nurse educators and integrative care advocates. And they bring both clinical experience, huge breadth of experience, and deep compassion to this conversation. Before we dive in, I'm going to just kind of do a little bit of housekeeping and kind of set the stage. So if you have questions throughout the presentation, you can always use the chat and go ahead and submit them. We'll address questions at the end. It's about a 60-minute presentation, and we'll have time for Q&A at the end. We'll try to get to as many questions as we possibly can. And if we aren't able to get to your questions, we'll do our best to follow up through email, et cetera, afterwards. And with that, I'm going to go ahead and hand it over to Sherri and Elisabeth and let them get started.
All right.
So we are. Good morning, everyone.
Yes. And if you weren't here last week, we have another encore for you on another very controversial topic: therapeutic use of psychedelics for palliative, hospice, and end-of-life care. My name is Nurse Sherri Mack, and I'm here with my business partner, Elisabeth Mack, and we're very excited to be able to present to you today.
So let's see. Screen slideshow. I need to get it so that I can get to the full screen.
Interesting.
Let me just reload it so that I can get back to slideshow. There's got to be a way to launch this.
There we go. Okay, so therapeutic use of psychedelics for palliative, hospice, and end-of-life care. My name is Nurse Sherri Mack. I'm here with my partner, Elisabeth Mack, and we're very, very grateful to be able to present to you today on this very delicate topic. So just to kind of break the ice and kind of make people feel comfortable on a subject that may not be very comfortable, this is a mushroom grow house. So Elisabeth and I had the opportunity to tour in Jamaica a mushroom grow house when we were filming a documentary. And so this was an actual house that was not only growing psilocybin mushrooms, but was also growing functional mushrooms. Mm-hmm. And these two little mushrooms here that you can see right on the screen are the ones that we picked, and they're in our hands. And we actually had an experience with these when we were in Jamaica a few years ago.
It sure made that a beautiful morning.
It did.
It's just filled with love, and my heart was so open. And that's what we're going to talk about here today.
Talk about the plant medicines and entheogens. Yeah. But we do have to make a disclaimer. This content is for general information purposes only, has not been approved by the FDA or any other official agency. And we also must make the statement that psychedelics are still illegal in many states. We do not encourage or condone the use of psychedelic substances where it's against the law. Oregon, parts of Colorado, and Massachusetts have legalized for personal use. However, ketamine clinics are popping up all over the country, and they provide a legal alternative for many to experience the benefits of these powerful medicines. We also accept that unsanctioned use of these substances does occur, and as nurses, we offer a responsible harm reduction approach to keep people safe. The essence of nursing is human caring for the entire human experience without judgment, and may you find hope in your exploration with us today. So just a reminder to you all, and we just covered this a little bit last week, recognition for cannabis nursing and plant medicine. So nurses are the only licensed medical professionals publicly supporting cannabis. The American Nurses Association, which represents 5 million nurses, actually recognizes cannabis nursing as a specialty nursing practice in 2023. In 2024, the book Scope and Standards of Cannabis Nursing was published. And the American Nurses Association has supported providing safe access to therapeutic cannabis and related cannabinoids for over 20 years. Cannabis nursing is holistic nursing. And we're not there yet with psychedelic nursing, but there are a lot of psychedelic nursing groups that have popped up all over the country that are trying to push the needle forward in this specialty nursing practice as well.
Absolutely.
So my name is Nurse Sherri Mack. Gosh, I've been a registered nurse for 37 years this year, 25 years in the conventional system at the big teaching hospitals in Boston. I've done a lot in my nursing career, including geriatrics, hospice, palliative care, home care, 20 years holistic nursing, 10 plus years in the plant medicine and cannabis psychedelic arena. I'm grateful to be Chief Nursing Officer of Holistic Caring in the Green Nurse and Vice President of Nursing of Bloom Hemp CBD. I do have an award-winning podcast. I sit on various different nursing organizations in the plant medicine arena. I'm on the board of directors of the American Cannabis Nurses Association and contributing author to Clark's Cannabis, a handbook for nurses.
And I am Elisabeth Mack. So I have been a nurse 1 year longer. And I spent my first 9 in hospitals, and then I got my MBA in healthcare administration to go into the business side of medicine. Spent almost 20 years inside insurance company operations and sales until I crashed my bicycle, went on leave to have surgery, got introduced to CBD and cannabis then, and said I was healing. So I didn't need the Motrin and the muscle relaxants. And I said, gosh, if I can help myself, I've got to help others. So that's how I fell into this industry as well. I'm the CEO of Holistic Caring and the Green Nurse, Holistic Caring Inc., our nonprofit, and Bloom Hemp CBD, the past treasurer of the American Cannabis Nursing Association, and I have several board positions still. And we are a corporate partner for the Aging Life Care Associates, which gives me great pride because I love working with older adults and their families. So Palliadelic, this is a fun word, isn't it? It's a neologism that refers to the use of psychedelics in hospice and palliative care settings. Fleming and Arezzo introduced the term palliadelic to describe the emerging integration of psychedelic-assisted therapies within hospice and palliative care settings. Their article in 2025 highlights how psychedelics such as psilocybin and MDMA may help alleviate existential distress, enhance spiritual well-being, and improve quality of life for patients with serious and terminal illness. The authors advocate for further research and careful clinical application to support compassionate, patient-centered care.
A journey home, psychedelics for peace, presence, and meaning at the end of life. So taking a psychedelic journey is almost like practicing dying. If you take a large enough dose of the psychedelics medicine or substance, you can experience pure consciousness, almost like you're no longer in a body. The experience is not for everyone, but for those who have had the opportunity, it has been life-changing, transformative prior to their final moments. Microdosing psychedelics, and we're going to distinguish between the two, can also be used as a tool for those who wish to explore the benefits of these substances. Macrodosing, taking the deep dive, the big journey, effects are immediate, while microdosing effects unfold over weeks.
And let's take a quick overview of the historical timeline. In the ancient world, the earliest proof of consumption of mushrooms was in the cave paintings in northern Algeria with the Tassili population, and they have been used for centuries and thousands of years by indigenous healers. The indigenous people in South America, Africa, so many places. But in this country, there wasn't a whole lot of psychedelic medicine being practiced. But in 1938, we began the first psychedelic renaissance with the discovery of LSD from the ergot plant by Swiss chemist Albert Hofmann. Many of you who studied Albert Hofmann know something about Bicycle Day, where he took a bike ride when he took the LSD himself and had quite the journey. And that kicked off everything for him because he knew it was going to help mental health. 1943 to 1970, the Western psychedelic era began. During this time, research was conducted on mental health disorders such as addiction, alcoholism, depression, and anxiety, all with LSD for the most part. 1947, Sandoz began marketing and distributing LSD as a psychiatric drug. But in 1970, 71, all of this came to a screeching halt with the Controlled Substance Act, where cannabis, psychedelics, psilocybin, MDMA, all of them became Schedule I substances, and they were not allowed to be used. Fast forward to 1986, we started the revival of human psychedelic research with MAPS, the Multidisciplinary Association for Psychedelic Sciences, led by the fearless Rick Doblin for over 40 years. And then in 2012, the FDA allowed for research, issuing breakthrough therapy. So it's sort of like a brand new therapy that's unproven, but it shows a very high likelihood of success. And they designated that for psychedelic research. And we've been going ever since, and we'll go through some studies. 2020, it really came a new era. The psychedelics emerged as game-changing options for neurogenesis, neuroplasticity, and a mental edge for high-tech workers using them as nootropics, that connectivity in the brain. Silicon Valley lit up with psychedelics, and really that microdosing craze began.
So conditions treated with psychedelics. So psychedelic medicines show benefits in the research for mental health disorders, including depression, anxiety, suicidal ideation, addiction, alcoholism, PTSD, OCD, panic disorders, and agoraphobia. Physical health issues such as chronic pain, phantom limb pain, smoking cessation, eating disorders, Lyme disease, Alzheimer's disease and dementia, migraines, cancer and its effects. And then spiritual health, including healing trauma, personal growth and emotional development, coping with terminal illness, fear of impending death, and existential crises. So psychedelics can help with the biopsychosocial spiritual healing so you can live your best life at any part of life, including end of life.
Mm-hmm. So multifaceted. So why psychedelics at end of life? On the psychological realm, there are benefits of enhanced emotional acceptance of mortality in the face of a terminal illness, reduced psychological suffering when traditional treatments fail, reduction of death anxiety, relief from depression and existential distress, supports the ability to do legacy work, that family, what do I want to leave behind? What's important? On the physical realm, the benefits include modulation of pain perception to promote ease and more well-being, improve quality of life in terminal patients, and then spiritual and existential, there's greater connection with self, others, and the universe, mystical experiences, which we'll describe shortly, and their role in peace and acceptance, and support for spiritual well-being with emotional closure. And mystical experience is defined. It is basically a profound altered state of consciousness characterized by unity, transcendence of time and space, ineffability, and deeply felt positivity. The core features include that unity, that loss of boundary between self and environment. You truly feel a oneness with all that there is. Timelessness, altered perception of time or a sense of eternity. Sacredness, feelings of awe, reverence, and spiritual significance, looking at the stars and seeing that you're one of them. The ineffability is the difficulty describing the experience in words. You simply cannot put it into words. And the noetic quality, sense of deep intuitive insight or truth revealed, that inner knowing, that communication with your higher self. Mystical experiences are not merely hallucinations, but deeply meaningful events that can transform a person's outlook on life, illness, death, and the nature of existence. The depth of the mystical experience is the strongest predictor of long-term benefits in psychedelic-assisted therapy. This can help individuals transcend fear, feel interconnected with others and the universe, and gain insight that leads to behavioral change, emotional healing, or spiritual awakening. Many lose the fear of death at the end of life.
Influences on the psychedelic drug experience. So this is individual to each consumer or person that wants to use it. So pharmaceuticals, what are other drugs or substances is the person taking? The dose of the psychedelic drug. So there's, I'm going to say 3 different levels of dosing. Microdose is subperceptual, meaning that you're not going to really notice, but it's going to be doing something in the background. Then you have the museum dose, which you're noticing. Things are just a little bit not right, but not bad, just a little bit different. And then the macro dose is the deep dive or the tripping, where you have that experience of hallucinations and other mystical experiences. There's many different ways to take it, and the route, it can affect how you would expect your experience. So the different substances have different drug routes. So the oral route is taking it orally, going through your digestive tract. Sublingual route, under your tongue. Imagine your mouth is a sponge. The medicine can absorb that way, bypassing the GI tract. Nasal inhalation, so that's snorting. Intravenous, in the vein. Intramuscular, or inhalation of the substance. And then each individual person might be a slow metabolizer or a fast metabolizer, meaning that you metabolize drugs and substances in a different way, and this can affect the experience. And then also the set and setting, the who, what, when, where, and why of you having this experience. The environment is really important, the geography. Are you doing this in a clinical setting versus in a home setting with a guide, or in a retreat setting, having a shamanic ritual type of experience? And then also a person's historical traumas, any previous mental health challenges, and what healing work has already been done. This can influence the psychedelic experience. And then also the psychological state of the explorer. Do you feel ready to explore your mind, your consciousness, and to do the internal work?
And many say that the mushrooms bring you what you need to
right.
heal. So now we're going to talk about the mechanism of action. This is how these medicines act in the body. The classic psychedelics are known as psilocybin, LSD, DMT, and they affect the brain a little bit differently, but for the most part, fairly similarly, because they're all direct agonists of the serotonin receptor 5-HT2A, which causes the psychedelic effects. We don't often stimulate that receptor. The classic serotonergic psychedelics create entropy, firing throughout the networks, allowing the brain to build new connections. And I want you to think of your brain as a snow globe. Usually there is just a few pockets that are lighting up sort of around the center, around the sides, the periphery. And with psychedelics, it's as if the snow globe has shaken, and now you have connections with all parts of your brain that you didn't have before. So entropy knits together the brain connectivity, weaving in imagery, hallucinations, visions, messages, and information from the subconscious. Many ask, is the trip necessary to heal the psyche? Are there any non-psychedelic 5-HT2 agonists? Are there drugs that nudge the brain this way without the hallucinations and dissociation? The short answer is no. According to Dr. Robin Carhart-Harris, UK scientist, tripping may be what you need to get your ego out of the way to heal. Antidepressants, SSRIs, work by softening feelings of despair, activating the 5-HT1A receptor that blunts emotions so that we can tolerate more stress, which isn't necessarily healthy. And we were talking about that in the pre-show, about how antidepressants make you feel sort of that numbness. It's okay, but you're not fully alive. And psychedelics can enhance that. And of course, we always say start with microdosing first. But on a macrodose level, this is a comparison of the different drugs, their onset, mechanism of action, and the effects. LSD has a fairly short onset, 20 to 60 minutes, but it's got the longest duration, up to a 12-hour trip. The mechanism is the 2A receptors, and the effects are that mystical experience, visuals, feeling egoless, expansive, euphoric, and creative. Psilocybin is the same effects, but a little bit different. 20 to 90 minutes on the onset, and that depends how much is in the stomach. And with all of these, you want to really fast for about 3 hours before you take any dosing. Other than microdosing, that's a little different. Duration with psilocybin is 4 to 6 hours, so a much shorter trip, 5-HT2A receptors, and the same effects. MDMA is very different. This is called an enactogen. The effects come on within 20 to 60 minutes. It lasts 4 to 6 hours. The 5-HT1A and 1B receptors are activated in the serotonergic system. And the effects are the euphoria, arousal, empathy, and a relaxed state. MDMA is used in couples therapy, also with veterans and PTSD, to get them to sort of talk through those experiences and soften the effects. Ketamine, we know as an anesthetic. It has a psychedelic effect as well at different dosing. 1 minute is the IV onset, so it's very quick. IM is also quick, and the troche is a lozenge that you put under your tongue, and you suck on that for about 10 minutes, spit it out, and then have that experience. Ketamine is relatively short-acting, 1 to 2 hours, and it affects the lateral habenula in the brain, along with the BDNF, the brain-derived neurotropic factor, which stimulates neuroplasticity, new learning, and that lateral habenula shuts off the depressive rumination. So it really can sever that. So it's very good for acute depression. Somebody that is suicidal can be walked back from that within hours. Ketamine creates a dissociative, dreamlike, mystical experience, and it is very soothing. And with all of these, for the most part, like with ketamine, it's like when the anesthetic wears off, when you come out of surgery and you've got a few hours after that, you're back to normal. It's the same sort of thing with any of these substances. DMT is a very fast onset, 1 minute with inhalation. It's generally snorted or smoked, and the duration is very fast, 30 to 45 minutes. 5-HT1A and 2A are affected here, and there are mystical visuals, egoless, expansive, where you can feel that pure consciousness without a body. Ayahuasca, 30 to 60 minutes, generally drank as a tea. The duration is about 6 to 8 hours. It is a 5-HT2A activator, agonist, and it also affects the MAO areas of the brain. And so you need to have a special diet before you do that. And again, that mystical visuals, egoless, and expansive experience is affected with that.
So then there's microdosing as the alternative. So if you're not ready to take a deep dive, well, microdosing is taking very small amounts, typically 1/10 the strength of a full dose on a set schedule to boost creativity, productivity, and overall satisfaction with life. It can work around the same time that an antidepressant does. So microdosing psychedelics is subtle in creating experiences below the perceptible threshold without hallucinations or impairment. Microdoses are repeated or given intermittently on a scheduled regimen and do not interfere with activities of daily living, nor will it disrupt your normal day. And so the benefits of microdosing is really good for the person that is new, that maybe want to take a deep dive down the line, but also has mental and emotional healing. It may take a little bit longer, but it does work. Holistic wellness and physical healing, peak performance and flow states, smaller shifts in perception, particularly around the death and dying experience.
And just like, taking CBD wakes up the endocannabinoid system to give you that foundational balance, microdosing can wake up those 2A receptors very softly so that...
gently nudging them.
Yeah. So, and there are protocols for microdosing. And if you look up microdosing online, you're going to find thousands of sites that have protocols and also sourcing of medicines. It is important to have lab-tested medicines and people that know what they're doing. It's growing very quickly.
It's a free-for-all.
Sometimes it is a free-for-all. But we do this and work with people all the time. So there are a few different protocols. I'm going to quickly glimpse here. The Fatimon protocol is microdosing every 3rd day, cycling 4 to 8 weeks, and then resting 2 to 4 weeks as a reset to let those receptors go back to normal. In between, the Microdose Institute protocol is every other day. There's 2 days a week, so you pick 2 fixed days like Mondays and Thursdays where you dose. And then that Stamets stacking protocol is Paul Stamets' recommendations for psilocybin, and the stack is the other functional mushrooms like lion's mane, reishi, and all of the other things that go together with healing. So day 1 through 4, say Monday through Thursday, you take your microdose. Friday, Saturday, Sunday, you are off. Day 8 through 11, you repeat again with your stack, and then transition days off. And again, cycling 4 weeks, and then resting 2 to 4 weeks in between the next cycle. There's a nightcap protocol for those who get fatigued with daytime mushrooms, and that are some of them, but most people get energized with them. So, but for those who get sleepy, it is not recommended with those for insomnia or sleep disorders, but people can report more vivid dreams and waking up feeling refreshed and brighter than they ever felt before they began microdosing. And so sleep is, something that we really need to accentuate in our life to feel good. And this microdosing for sleep Some people really attest to it. Our attorney is one of them. And again, you cycle on, and then you have some days and weeks off.
So now we're just going to kind of shift a little bit back to cannabis and psychedelics, because cannabinoids can be facilitators of the psychedelic experience. And a lot of people have had the question, is cannabis a psychedelic? Well, yes and no. It all depends upon who you ask. Scientifically, psychedelics are drugs that activate the 5-HT2A receptors, while cannabinoids in cannabis activates the CB1 and CB2 receptors of the endocannabinoid system. And cannabis also indirectly affects serotonin. So difference in the receptors that it's hitting. However, high doses of THC can cause paranoia, hallucinations, and psychosis. Ask any person who's taken too much or greened out. It can be very scary, but you will not die from overconsumption of cannabis. Generally, low doses of THC, CBD, and cannabinoids do not induce hallucinations or psychosis. It is very, very rare for a recreational consumer to have a psychedelic effect unless purposefully over-consuming high THC products or mixing different products, edibles, concentrates, and dabs. But there is a practice called psychedelic cannabis journeying. And so I actually did this with another nurse in the field, and she had a practice where she set up clients on a journey. And so what it was a group setting where a client is led on a guided meditation after a ceremony of frequent inhalations of mixed cannabis flowers. So intentions are set, affirmations are set with each inhale prior to closing the eyes and being led on a sacred journey with music. And this practice can be customized to each person. Afterwards, experiences are shared if done in a group, promoting clarity, healing, and integrating the experience into your daily life. Mm-hmm. Now I'm going to talk a little bit about how cannabinoids can be facilitators for the psychedelic experience. So many people use cannabis in combination with other psychedelics. We encourage you to be cautious and to use this under the guise of a guide. But moderate doses of THC can be used to mitigate side effects of nausea from psychedelics. Higher doses of CBD can be used to mitigate any side effects of anxiety from using psychedelics, and this includes microdosing. CBD and microdosing goes very well together. Higher doses of THC to intensify the trip or the psychedelic experience. THC actually scrubs the 5-HT2A receptor, actually priming it, making it more readily available for that psychedelic to plug in. Moderate doses of CBD and THC to lessen come down effects and to promote sleep. So you have to remember that when you're in the psychedelic state, you're flooding your body with all of these different neurotransmitters. And when you're coming out of it, you need to get back to homeostasis. Cannabinoids are those plant medicine facilitators to get you back into homeostasis. So cannabis and psychedelics can slow down time and intensify the present moment. The difference has to do with setting, substance that you're using or substances, sitter, who is being there with you, the session that you're having, and the situation, which is different for each person and each consumer. So psychedelic trips release explorers from the day-to-day consciousness so vividly that a few puffs of cannabis seems tame in comparison. So for example, inhaling a cannabis joint, it's much shorter acting than taking a very large 5-gram lemon tech psilocybin trip. Very different experience. But we want to talk about how this is going to improve neuroplasticity. So ketamine, psilocybin, and LSD are compounds that do promote neuroplasticity and new neural connections. And the antidepressant effects of psychedelic drugs is contingent upon enhanced neurogenesis. And this is new brain cell growth. Cannabis can also spur creation of new brain cells, unlike alcohol exposure, which disrupts adult neurogenesis in animal models. THC at small doses can increase neurogenesis by activating CB1 cannabinoid receptors in the hippocampus, the locus of short-term memory, long-term, and spatial memory. CBD in general reduces anxiety and depression by stimulating neurogenesis in the hippocampus. So this is just an example of how and why you might combine cannabinoids with psychedelics.
Yeah, it's not just one thing. So now we're going to pivot into some research and just talk about, where we are today in America. and globally a little bit. This is not just an American thing, this is everywhere. But I mentioned that the FDA initiated breakthrough therapy research, and that was for the team at Johns Hopkins. In 2016, they published their research that showed a single high dose, 4 to 5 grams, depending on weight, psilocybin session led to significant and sustained reductions in depression and anxiety among cancer patients, and it lasted for up to 6 months. NYU study, 80% of participants experienced rapid relief from emotional distress after one guided psilocybin session. And the clinical outcomes and benefits are that it's fast acting, effects within hours versus weeks for SSRIs, long-lasting effects from a single session, and enhanced emotional peace, spiritual well-being, and acceptance of mortality at the end of life.
And in 2023, ketamine for depression and palliative care. So ketamine's rapid onset makes it especially attractive in palliative care settings where time is critical. And this underscores both its promise and the need for larger controlled studies in this population. There are ketamine clinics that are popping up all over the country, and this is a legal way for people to get access to it. So this study was a systematic review looking at 32 total studies, including 7 randomized controlled trials, observational studies, case studies, and case reports. And the evidence showed the rapid antidepressant effects of ketamine in palliative care patients. Case reports and series showed robust mood improvements in all of the participants. Ketamine was generally safe and well tolerated. The side effects of dissociation were manageable. It's considered to be a dissociative anesthetic anyways. And the quality of life implications. So most studies use depression and anxiety scales for quality of life, and the relief of symptoms may improve remaining quality of life. So ketamine offers a potential paradigm shift versus the slow-acting traditional antidepressants, and ketamine can be accessed in a clinical setting and is a really great option for those that are new and want to explore this.
Mm-hmm. So psychedelics support self-transcendence theory. Otterson and Lee highlight how psychedelics can help alleviate existential and spiritual suffering, support patients with serious illness, reduce fear of death and anxiety, promote spiritual well-being, enhance connectedness and meaning, encourage acceptance of mortality, and align with self-transcendence theory. The authors link these outcomes to Reid's theory of self-transcendence and how moving beyond the self can promote adaptation to life's final stages. Their work supports the use of psychedelic-assisted therapy as a compassionate and holistic tool in palliative and end-of-life care. Self-transcendence is the expansion of personal boundaries in ways that promote well-being and adaptation, especially in the face of illness, aging, or at the end of life, knowing that one goes on.
And psychedelics reduce death anxiety. So this was a cross-sectional survey conducted in Brazil, over 517 adults. They used the death anxiety scale, death transcendence, and spiritual well-being scale. And the key findings of this 2025 study was that individuals who had never used psychedelics reported higher levels of death anxiety. And a consistent negative relationship was found between death anxiety and factors of death transcendence, particularly mystical and religious aspects. The experience of death transcendence, knowing that one goes on after death, rather than the psychedelic use alone, is what reduced the death anxiety. They actually had an embodied experience. And so the interpretation is that psychedelics may facilitate experience of death transcendence, offering a sense of continuity beyond physical death, which in turn helps alleviate the feelings of death anxiety.
And no other drug has achieved this, and why we need to keep going and in the research. Psilocybin for depression and anxiety in the cancer patients, that single high dose of psilocybin reduced depression and anxiety in 92% of patients with life-threatening cancers with sustained effects over 6 months or more. Psilocybin for smoking cessation. In a pilot study, 80% of participants used psilocybin remained abstinent from smoking after 6 months, far exceeding typical success rates of 15 to 30% with patches and behavioral therapy. And you can see life satisfaction, creativity, improved social relationships, and mood are all up. Cluster headaches, depression, anxiety, PTSD, addiction, and OCD are all down. And that is really significant, especially when you compare it with conventional care. Antidepressants and psychotherapy have delayed effects, 2 to 6 weeks to establish any efficacy, requires continued dosing and monitoring of side effects, often lacks the existential and the spiritual support. It's just the drug and the therapy, and it doesn't always work. Whereas ketamine, psilocybin-assisted therapy, rapid symptom relief of depression, sustained emotional and spiritual gains, and facilitates deeper engagement with life and death. Safety and oversight, there are minimal adverse effects when in clinical guided settings, and there are growing calls for standardized protocols and legal pathways. These results are reshaping end-of-life care. Psychedelics offer a more than comfort, fostering peace, connection, and emotional healing, but must be used with clinical support for safety. And all of the trials that we just went through, were in clinical guided settings where you've got the guides, the medicines, the bed, everything was set up perfectly. People can do this in home retreats, but you always need to have somebody with you, somebody that's a sitter, that's not taking the medicines, etc. And we can help set that up.
So compassionate care with psychedelic-assisted therapy can support holistic person-centered approaches to addressing existential and emotional suffering at the end of life. So a person-centered focus integrating physical, emotional, spiritual, and existential care through psychedelics and compassionate care framework, addressing death anxiety and existential suffering, supporting patients in finding meaning in life, emotional resolution and acceptance at the end of life. And then interdisciplinary trauma-informed care highlights the need for trained, compassionate, and collaborative care teams delivering the psychedelic-assisted therapy. And then ethics, research, and policy gaps. This calls for rigorous studies, ethical guidelines, and evidence-based integration into palliative care models.
And when we're back to pharmaceuticals versus psychedelics, if you're on the fence about medications versus psychedelics, consider the pros of a trial of microdosing psychedelics before trying the pharmaceuticals. Not taking the deep dive, but microdosing. Pharmaceutical resistant, treatment resistant affects 20 to 60% of patients with psychiatric disorders, and even treatments with 60% efficacy, which is about the high for antidepressants, come with very unpleasant side effects, leading to poor compliance, disrupted neurochemistry, and recurring symptoms. If you're struggling with anxiety, depression, or PTSD, a short trial with plant medicines may be what you need for a reboot to improve quality of life. So we suggest that you microdose first or use psychedelic-assisted therapy with a clinician to guide your experience as Plan A, and you can always try the pharmaceuticals as Plan B. Remember that with a large psychedelic-assisted trip, the duration is 12 hours tops, but not many people use LSD. It's the psilocybin or the ketamine that people use, and then microdosing is that subperceptual where you don't even feel it, but yet it's activating some of the healing receptors and pathways in the brain.
And then we have the importance of integration. This is the experience of integrating what you've actually experienced into your day-to-day life. So millions of people have had a psychedelic experience, and without proper support, it can be challenging to understand and fully integrate these experiences into their life. So the psychedelic experience without integration is just potential. So the goal is to become stronger, more resilient, adaptable, and more loving to yourself. And this can even happen at the end of life. We've seen it. Spiritual, emotional, mental, physical, relational, social, aligning your inner and outer life, releasing, processing, integrating. And then the integration serves two main objectives. So maximizing the benefits and assisting with lifestyle changes necessary for healing via coaching, and then minimizing the perceived discomfort of processing emotions around a perceived bad trip and providing support for healing. One of the most difficult things we have to do as humans is to process emotion. And so we need to have a space that is safe for us to be able to do that. And this is the process of integration. Psychedelic integration outlines holistic foundational practices, taking care of your endocannabinoid system. For example, rest and nutrition, spiritual approaches, doing specific rituals, water rituals, tarot reading, the cards, embodied techniques, body work, somatic work, dancing and singing, movement, breath work, integration circles to focus on the use of empathy and acceptance. And clinicians and nurses working in the plant medicine space with psychedelics are sensitive people and perfect for involvement with ongoing integration and support, because many of us have done these substances. So caring for your endocannabinoid system, which is the largest neuroregulatory system in our body, is a big part of integration to keep you in the relaxation response as you process emotions and insights from your use of psychedelics.
You can see we put it into context. So are psychedelics for everyone? The answer is no, they're not for everyone. And to avoid doing harm to both the participant and the guide, skillful screening based on good information is important. The following factors, exclusion criteria, should be considered in the screening process, and particularly for those who want to take a deep dive or that macrodose. Age, the participant should be of legal age and consent. On the upper ages, we've seen people in their 80s taking these substances, even up to 90, and they do just fine if they're physically okay. Stability, a stable life with housing, a safe space to reflect upon one's internal process. If female, not pregnant or breastfeeding. Disabling medical conditions, no unstable cardiovascular disease or severe hypertension. When these drugs have their onset and you're feeling them that 20 to 60 minutes, there's a flood of neurotransmitters, and so the heart rate and blood pressure can increase before it settles out and the body's autonomic systems stabilize us. So we want people to be stable. Disabling, unstable, or acute mental illness or addictions, no active alcohol or drug withdrawal. Personality disorders, those people are at higher risk for prolonged destabilization. No anger management, history of violence to self or others, recurrent suicidal or homicidal ideation. No active unmanaged neurological disorders such as stroke, dysautonomia, epilepsy, serious brain injury. We want to minimize adverse events like a seizure. Current use of tricyclic antidepressants, SSRIs, most of the standard antidepressants, MAOIs, St. John's wort should all be avoided due to the risk of serotonin syndrome. There are drug washout protocols that have about a 2-week abstinence from that other drug. So you wean your antidepressants, 2 weeks off, and then you can take the deep dive. Microdosing is okay. For the most part. No individuals on mood stabilizers, lithium, Depakote, Haldol, Risperidol, antipsychotic medicines. We don't want serious mental illness, psychosis. The same thing with cannabis. You want to avoid these types of drugs. Or people being unwilling to self-reflect or take responsibility for your actions or do healing work. That, again, is a red flag.
So therapeutic use of psychedelics is the use of entheogens, these substances, for medical wellness and healing purposes, particularly for mental, physical, and spiritual health. An entheogen is that psychoactive substance, a psychedelic substance that induces the alterations in perception, mood, consciousness, cognition, or behavior for the purposes of engendering spiritual development and sacred texts. So the therapeutic use of psychedelics is personal and subjective to each consumer, with the objective criteria being improvement in one of the 5 health domains: biological, mental, emotional, spiritual, and social, without negatively impacting any of the others. So this is a new dawn, and much like cannabis as medicine, legitimacy is fought for rather than assumed in the medical model. So clinical trials are underway for the lucky to access these medicines, but there's a vast underground ready to help regular psychonauts explore. And then there's the ketamine clinics. So as nurses, we help others to be safe to explore their mind and consciousness while using these substances for medicinal healing and wellness purposes. And this is an image here of Nurse Kay Parley, who was actually guiding patients in the 1960s on LSD.
Yeah, the LSD experiments.
And this is Kay Parley years later, and she actually wrote a book called Inside the Mental Silence: Stigma, Psychiatry, and LSD. She just recently died this year, and she was actually the first psychedelic nurse. So Nurse Kay Parley was noting what early researchers discovered. The psychedelic experience led patients to scan their life, to gain new perspectives, find meaning in past events and relationships, explore traumatic wounds, gain insights into their feelings, or experience a range of emotions that led to self-healing. Just like nurses create conditions conducive to healing of the body, like nurses keep the wounds clean and well-dressed, the nurse-guided psychedelic experience often allowed patients to discover their capacity for emotional healing. So nurses hold space for the biopsychosocial spiritual healing and are natural problem solvers, and nurses make perfect psychedelic guides.
So, who can be helped with psychedelics? Individuals with treatment resistant mental health conditions. Psychedelics may offer promising options for individuals with treatment resistant depression, anxiety, post traumatic stress, mental health issues when traditional therapies have proven ineffective. Individuals pursuing personal growth and self discovery. For centuries, psychedelics have played a significant role in spiritual and self exploration practices. Those seeking insights, personal development, or a deeper understanding of themselves find psychedelics to be a valuable tool. And this is the shamans and the worldwide history of that. Addressing end of life distress. Ketamine, psilocybin have potential to alleviate existential distress and enhance quality of life for individuals confronting life threatening illness, palliative care environments, and legacy work. And individuals seeking transpersonal or spiritual experiences. Psychedelics have long been employed in numerous spiritual and shamanic traditions to induce altered states of consciousness to promote transcendent experiences.
And then we have Joan here. So Joan is 84 years old. She's a friend of ours. She's not actively currently dying, but as you know, when you get into your 80s, you are at the end of your life. And Joan wanted to share her psychedelic experience with you all. So Joan microdosed psilocybin over an 8-week period and had 3 ketamine sessions. And these are her quotes. I had a series of ketamine treatments in a clinic to experience the benefits. It was awesome. I experienced 2 spiritual openings that gave me so much peace. I could not believe it. The main reason for doing this is to open more neural pathways and keep my brain going strong. I also use Bloom Hemp CBD products for integration and to stay balanced and to get better sleep. I feel really comfortable in my skin, and I'm 84 and I'm not afraid to die anymore. Isn't that great? Yes, that is great.
And this is more on the physical side, but it crossed over into spiritual. This is a patient that I was taking care of, Don, who microdosed psilocybin along with cannabis for severe pain. He was at end of life, and we introduced cannabis oils, CBD, THC, and 1-to-1 extracts for pain and to slow the growth of rectal cancer cells. He was in so much pain. It was hard to be around him. He was hurting so much. Pain was not fully controlled with the cannabis or the oxycodone, which he was taking round the clock, and he was beyond miserable. So we introduced microdoses of psilocybin chocolate squares, about 250 milligrams once daily before lunch. And this enabled him to feel better, enough to get out of the house again and to enjoy lunch out with his caregivers. They played games, they played cards. He was able to have that wholeness again. His pain was palliated with the psilocybin over other pharmaceuticals, and that allowed him to have a better, more peaceful passing. And I have had some psilocybin, and the migraines improved a lot. And cannabis and psychedelics both help with pain significantly. And we have each had deep, rich experiences with micro and macro doses of various psychedelic substances for our own personal healing and to understand them better for teaching and guiding others. Hands-on knowledge is priceless for us to be able to better lead others in this novel field of therapy. And I really do believe that you do need to try these sacred medicines to be able to have that intellectual, spiritual, emotional connection with somebody else who wants to try that. And we have sampled these different substances.
And so at the end, we will answer any questions that you have of us, of these particular substances that we've actually experienced ourselves.
Mm-hmm.
And so again, health is mostly about function, not disease or death. Health is fundamentally about what an individual can do here, today, right now, and that's even at the end of life. Health is our physical and mental energy, whether we can fully use our senses, the extent we can comfortably engage in meaningful activities to do what? Live our best lives, right? Health is our strength, our memories, our ability to solve problems. It's our ability to cope with the challenges of life, our ability to build and sustain intimacy, our sense of agency, positivity, and purpose. And this can even happen at the end of life. Healing isn't the absence of illness or disease. It's living your best life and doing your best at any given moment, even at the end of life. Cannabis and psychedelics are tools for optimizing health functioning and expanding our consciousness for healing and to help us have a better perspective at the end of life.
Yeah, and conventional care looks at us as a body, right? Physical, maybe some mental.
Well, they decompartmentalize. That's what they do. So they put us in a box into a category. They
But
don't
this
look at full
slide
person
shows
health.
that we are whole person. It is
We are
literally
multidimensional.
all of these different dimensions at once. So psychedelics hold the potential to revolutionize healthcare for millions of people underserved by conventional medicine. Psychedelics is very personal. And the most important part of this is the interpersonal work to find efficacy and lasting change. A miracle, as we say, is a change of perception, the aha moment when it just makes sense. Psychedelics may help you make sense of life when nothing else makes sense, and may help you lose the anxiety and fear around death and dying. So please join our network and let's keep growing together.
And we do have, for people that are new to psychedelics, want to explore psychedelics, we have a mental wellness bundle for psychedelic explorers, CBD products, optimizing the endocannabinoid system for mind, body, spirit wellness with comprehensive protocols spanning 4 to 8 weeks. These products harmonize digestion, energy, relaxation, guiding your inner equilibrium to start thriving. So this is actually, if people are new and want to explore psychedelics, we pair psychedelics with CBD and cannabinoids. Again, we saw that slide, and it helps people to have those better, rich experiences.
Yeah, and to set the foundation.
And then just a little bit about us at Bloom Hemp CBD. So what makes us a little bit different? We're woman and nurse owned, USDA organic hemp CBD, doctor and nurse formulated, Ayurvedic inspired symptom targeted formulas. We have a free nurse line with a pharmacist on staff that answers the phone when we're not able to answer the phone. And we have free care plans and a free network. Over to the left, free emailed care plans are available. We do not sell psychedelic substances. This is all hemp CBD. So for those that are new, that are interested in having an experience, we would start you off with CBD and then continue to triage you to see where you might fit best in the psychedelic experience realm. We have a particular different intake form for that, but we would generally get people started on CBD first. And then over to the right, you can see the beautiful flowers, the Bloom Hemp shop. If you just wanted to go shopping, we do have a special offer, Senior 20 for 20% savings.
Yep. You can just scan that with your phone. And then we have an Introduction to Psychedelics as Medicine program. This was just a glimpse of what is in this. It's about a 12-hour program. We have 8 hours of continuing education units for nurses. It is a self-guided program for the history, renaissance, legalities, and pathways to healing of the most common psychedelic medicines on the planet. And it is a deep dive on each and every one of them and the clinical process in guiding people there, because we do this and we teach it. And we welcome you to join our network. This is the Holistic Caring Network for the Green Nurse and Bloom Hemp. It's the structure and framework to hold the products and services that patients need to be successful with plant medicine therapeutics. If you scan that with your photo app right now, you'll go right into the network. There's just say who you are and enter your email and you can join. There's a free Introduction to Cannabis program, ABCs of CBD, a patient portal to connect with peers, monthly plant support group where we talk about this openly, not recorded, just a place to be real. We have monthly clinical conversation webinars and podcasts. And then the patient programs is our targeted e-learning like cannabis and cancer and dementia and Parkinson's and MS and autism, epilepsy, autoimmune, mental health, you name it. And then we have the professional training programs that all have continuing education units for nurses. Call our Hope line, 970-404-HOPE, to be talking about any of this and how you might interface with us.
And then if you have any questions, we have a blog that we do, Ask the Green Nurse on Substack. Any questions, you can email us, info@bloomhemp.com or info@holisticcaring.com. We will reply back to your question, but your question also might be chosen to be a blog post where I actually write and do the research and publish it. So please participate in Ask the Green Nurse and be a citizen scientist.
We love citizen scientists. And this is also being picked up by the Kenigma, and we are hopefully going to get syndicated with newspapers around the country. And those that are willing, that have really great testimonies can even come on the podcast and share their story. Well, thank you, Empowered Endings, for having us back 2 weeks in a row, and you'll have great content in your network, and we hope to be of a resource going forward as nurse clinicians who work in the plant medicine space for the past decade. It is an honor and a sacred journey of us, as Carmen attested to, doing the right things for the right reasons with the right people, with the right intentions. So God bless you
Thank you
all.
so much for joining us. We appreciate
Thank
you,
you.
and we
Thank you.
appreciate everybody who joined us. We will be in touch with the link to the replay in the next 24 hours or so. And if you have any questions, feel free to reach out. We're more than happy to connect you to Elisabeth and to Sherri to get any other questions answered. And you can also find links to resources that they have shared in the online course space, right in the additional resources section. Thank you so much, everybody.
Thank you. Bye-bye. Have a great day.
Bye.